Welcome to the Life's Best Medicine podcast, where we are finding hope and healing one episode at a time. No appointment needed, no rubber gloves, and no coping. Just a healthy dose of life lessons to help equip you for this wild journey we call life. My wife and I are actually traveling in the near future for some family obligations, and we were talking about the airline sending out a preference for snacks, and we just laughed and said, we have Simply Snacking. We don't have to eat those terrible little packs of pretzels and whatever they give you that aren't that great anyways. Have some good beef and chicken and be healthy for your trip. So I would recommend you do the same. So it's easy, convenient, great company, great product. So look up Simply Snacking. We'll have a link at the end of this podcast, and we appreciate their continued support. And have a great August, everyone. September coming up next. Hey, everyone. This is a friendly reminder that we are here for entertainment purposes only. We may not even be that entertaining at times, but this is not medical advice. Talk to your doctor, check with your healthcare professionals before making any lifestyle changes or medicine changes. What we're talking about is our clinical experience and what we've seen. And so if you really want our advice, you can consult us. You can actually consult me as a doctor, or you can consult my guest and get all your questions answered. But we can't give free medical advice, because we can't pay our bills with that, but we can help to educate you a bit and allow you to think a little bit. And always reach out to your medical professional before making any lifestyle changes. Thank you. Hello, and welcome back to the Life's Best Medicine podcast. I have two docs of physical therapy here. They're doing some awesome stuff. So Owen and Jen, welcome.
Thanks for having us.
Yeah, thank you.
Yeah, advanced physical therapy and wellness here in San Diego. So it's nice to have like-minded people trying to be on the same team to get people healthy. And so tell people your journey and how you started and how you got to where you are now.
Okay, so well, first of all, I'd like to give an announcement, and that was 1 year ago today. I proposed to this lovely woman who is now my wife. 1 year ago today.
Awesome. Congrats. I'm glad we can memorialize that.
And so the interesting thing enough is when I did propose to her, I was on my first day of unpaid admin leave from Kaiser, because my religious exemption was under question and then eventually became denied fairly soon after. And when I was talking to Jen about it, one thing that's been great about her is I have a supportive partner. She said, I understand what you're doing, and I have your back 1000%. And I talked to a lot of other people that work for Kaiser too, that their spouses were not on the same team as them. Like, oh, come on, why don't you just spit in a cup, or why don't you just, do what they want you to do and just keep your job? And they didn't want to, and it was going against their beliefs.
Yeah, that was a hard thing. A lot of docs and nurses reached out to me. They go, Brian, what do I do? I'm going to lose my job. I have debt. I have kids. I have stuff. And the amount of stress that caused a lot of people. And, I left the system before that. I had just seen the craziness of, this treadmill of patients coming in, and you can't really help them, and you're in a hurry all the time. And, that was my exit. And it was the same thing. I talked to my wife about it. She goes, get out. What are you doing? Like, I totally 100% support you. And having that support is huge, because it's a really big decision when you have your, you thought was your lifetime job, and then all of a sudden you start realizing, things are changing.
That actually was my experience with physical therapy. I went to school for 7 years, became a doctor of physical therapy, got what I thought was like my dream job. And I realized that I was handcuffed by the insurance companies as to what I could actually do for my patients. As a physical therapist, I could sit there and have someone come in with back pain who's drinking a Coca-Cola, 50 pounds overweight, and I couldn't mention any of that because that wasn't within my scope of practice. I had to treat just their back, knowing that like the back was caused by all of the lifestyle things. So I just felt like I constantly on every like a day-to-day basis was doing a disservice to my patients, that I couldn't really truly serve them because I wasn't allowed to treat the holistic picture of it. And that was just a crazy thing for me. I actually only practiced for 7 years before I completely left the field for another 7 years. I'm just back in now that we opened our practice. So I feel you on that kind of treadmill of patients and just not feeling like you're able to help them, and you have to choose a different way.
Yeah, it's hard when it's the elephant in the room and you see it and you say, gosh, you're drinking all these pro-inflammatory things, you're eating terrible, you're staying up late, you're stressed out, you're drinking too much, and all those kind of things. And you know, in the standard care, they say you can't talk about that. And I understand the doctors have 7 or 8 minutes with the patient. So that same organization that you used to work for, I'm getting a ton of patients from them just because they don't spend time with the patient. And the patient says, look, if I get hit by a truck, I'll go over there, but I want to be healthier. So we're kind of cheating the system in a way because patients are motivated to be healthy and they're motivated to get better and not just be, you know, I've dealt with the workers' comp system before, and uh, I've seen where like people will malinger, or the workers' comp will say,
Yeah.
okay, come back in a month and come back in 2 months, come back in, and they don't get better and they're there for a year course of treatment without any improvement. And it's crazy.
Oh yeah, I used to work for a clinic too that did work comp, motor vehicle accidents, as well as like personal injury lawsuits and stuff like that. And I ran into the same things time and time again. And even in the military, interestingly enough, like people coming in, they didn't necessarily have a retirement plan. I feel like, and so then they're like, well, permanent disability or partially disabled, it's going to be my retirement plan. And so they weren't getting better because they didn't want to get better. I'm sure there were some aspects of it that could have been going on, but also too, the psychologically and as well as dependent, they didn't actually want to get better. And it was really difficult and really frustrating as a new clinician back then. When I was a brand new physical therapist, fresh out of school, I was taking it personally. I was going home, I was diving through the research while being overworked and underpaid, and trying to get these patients better that clearly didn't want to get better. And it took me at least a year or two to figure out which ones were actually doing that and come up with kind of some tests and measures to kind of tease them out. And it was challenging.
Then Jen, what brought you into physical therapy? What was your draw?
I was a varsity gymnast from 7th grade on. So I was very demanding on my body, and I had a lot of different injuries. And, you know, when you do something that competitively, like you're going to have problems. And I went to physical therapy myself for my knee a couple times and my shoulder once. And I just thought it was so cool. Like all I saw was that the physical therapist got to like play with you for like a half an hour, 40 minutes. You know, it's like, oh, they get to like do sports all day and like help you feel better. So I just thought it looked like so much fun. And I didn't know like the back end documentation part of all of it. So I kind of went down that path. I knew I wanted to be in medical, and I was deciding between orthopedic surgery and physical therapy. And I was told by multiple people that I was too small for orthopedic surgery. And I shockingly listened, which is not usually my personality type. And I decided to go into PT. And yeah, that was kind of my pathway for it.
That's awesome. How about you, Owen?
So when I was 15 years old, I fell off a cliff. It was a hiking accident and I snapped my tib fib, complete fracture. And now I have a full inch leg length discrepancy from it. So my tibia and fibula are kind of lined up like this, and then the bone healed around them. And I can remember, like, seriously, it was tough. Like my parents had to help me get to the bathroom. They had to help me get in and out of the shower. It's like, that was like what home health does these days. My parents were the home health PTs. And then after that, I remember the greatest day of my life was I was on crutches for 6 months. And the greatest day of my life was when the doctor said, you can walk again. He was like, you can walk. And I wasn't sure I don't think they really had too much physical therapy back then, because there was just probably an ortho, some sort of doc that was like, no, you can put full weight on it. You might want to bring one crutch with you. So if your leg gets tired, because it was super atrophied, it looked like a ET leg. And then my stepmom dropped me off at school, and she was like, you're going to take one crutch, like the doctor said, or if you get tired. They didn't even tell me what hand to carry it in or anything. And I was like, no, I'm walking. So I walked really slow. And that was probably like, I literally felt like a child on Christmas morning, or maybe even the night before Christmas, like full of joy that I could just walk again. And then let alone when I was able to join my wrestling team, because I couldn't do cross country that year. I was always an athlete all growing up, and sports was a big part of my life, just like Jen. So I figured physical therapy was going to be an outlet for me to, number one, help give people the joy of a child on Christmas morning by getting them able to do what they want to do again. B, get paid well, 'cause I thought that I got paid well. And then 3, live where I want to live, because it was like the largest and fastest growing field at the time. So I figured I could just kind of kill 3 birds with 1 stone, and I was going to be able to work with people all day long and help people, giving them the gift of being a kid on Christmas again. But when I got out of school, it was not quite that.
Yeah, and that's the hard thing, because all of us went into the healing arts really just to help people, and we want to see people getting better. And it was kind of the same thing that I was seeing is, you're throwing another drug, and in 2 months you just throw another drug at them, trying to get the sugars under control, and you realize you're not benefiting. And plus, doing the standard of care, which was the ADA's recommended diet, I'm like, these people are getting worse, and I'm getting worse. So sometimes you start realizing, like, okay, we're doing these same things over and over without. You're kind of just going through the motions, and you're not helping people anymore.
Yeah. So like for me, when what I envisioned physical therapy was going to be like when I was in PT school, I thought I was going to be working with people all day long. I thought that I didn't really know about the documentation aspect of it. Instead of seeing 4 patients an hour, I envisioned seeing 1 patient an hour. And I didn't imagine myself going in 2 hours early every single day to get caught up on notes on my own time, because I was getting paid salary. So I was working like 60 hours a week to get paid very minimal. One of my buddies talks about like stealing cookies from assisted living while working in home health as a PT as a new grad, because he was in so much debt and that he couldn't afford to pay for even his own food. And I definitely felt the stress of that, while also too feeling like I wasn't getting the patient better, like you guys talked about. I call it conveyor belt pizza oven, because I used to work at Domino's Pizza, and I literally felt like I was working at Domino's Pizza during rush hour from like 5 to 7 when dinner time was. But instead of 5 to 7, it was 8 hours a day running around with my chicken, like a chicken with their head cut off, going like, you do this, you do that, you do this, you do that. And then the patients were just going through this conveyor belt oven pizza and then just going out, in and out, in and out. And our outcomes were pretty poor.
Yeah. So your hand was forced. So it's kind of a blessing in disguise, right? Your hand was forced to go on your own. And that's a scary jump. I speak from experience. So, going from the insurance model to a cash pay model, what were your fears going into that? And, how do you get your name out there and all that kind of stuff?
All right.
I was kind of grooming him, to be honest, for like a year of dating, because I've been an entrepreneur for like 8 years now. So I was working the magic on the back end of helping him see the vision of all of it. So once everything came to head with Kaiser, and it was a decision of our values and morals versus their rules that weren't even legal, we were so solid, and he'd already had a little bit of a foundation of like, I'm going to go into this. I know that I want to pursue this. And it was, I remember him kind of looking at me when it was all going on saying, hey, you've been kind of setting me up for this, haven't you? And I'm like, just a little bit. So it was kind of fun to see that shift and that change in him. But yeah, what was that like, babe, when we started just about a year ago? We started envisioning this whole dream.
Yeah. So yeah, I opened up the practice almost a year ago. It's been about 11 months. Yeah, 11 months today, because it was October 4th last year. And like Jen said, she was literally grooming me, because I know this because I soon got into business coaching. I got a mentor a week into business, 1 week in. And it literally was a God thing. Like God was like just putting these people in my life, like boom, 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 boom. It says like Jesus is at the door knocking. Are you going to open up? And I just opened up each door, and it wasn't always easy walking through, but I mean, the rewards have been phenomenal. So I was led by like a couple different people to this guy named Aaron LeBauer, who is kind of like a rebel in the PT world, because he's one of like the gurus of this thing called cash PT. In fact, I'm pretty sure he owns the term cash PT. He was a massage therapist that he went into PT school to actually help people. He didn't have objective tests and measures as a massage therapist. He was helping people, but he wanted to fully be able to embrace helping people. When he's in his clinicals, he's like, this doesn't make any sense. And everyone's like, he's like, I'm going to do cash PT. And all his clinical instructors said, no one's going to pay you for that. No one's going to do that. And he said, yes, they will. They pay me $150 an hour as a massage therapist. They're going to pay me more as a doctor of physical therapy. And he was right. So I was led to him week into practice, and it was very scary, like you said, but he was having me do all of these visionary goal setting things that Jen was having me do from day one of dating her. She was like, imagine yourself waking up in the morning. What does it smell like? Who are you next to? What kind of floor do your feet first hit the ground? Imagine like what the sheets even feel like as you wake up. And then where are you looking? What house are you in? Trying to just create a vision. And he literally did the exact same thing. So when I got into his programs, I was almost like a little bit of a step above. So I was just like, I've already done this before. Boom, let's go. And then, but it was challenging. It was not easy. When my business coach was like, what are you doing? You're charging way too little. Your services are worth way more. Sell in packages to make people more accountable, to stick to the plan of care. I was like a deer in the headlights. That's what I felt like. I was like, what? I'm supposed to do what? And I'm supposed to charge what? Because I feel like the school system and the insurance-based model, they really make you devalue yourself as a practitioner. You literally feel like you're worthless. I did anyways. I don't know about you, but I did. I felt worthless.
Yeah,
So
I think that's a part of it. A lot of doctors now. I was just at a medical conference, and to hear the burnout rate, like when I talked to you about both of you about PT and what you're doing, you're excited and your eyes light up and you're excited. So many doctors I talked to, they're like, I got to get out. I'm done. So, you look at the burnout rate of physicians, and it's staggering. It's actually shocking, because these people I know from experience have 200, 300, $500,000 in debt, and they're handcuffed now. Right now, you're another cog in the wheel, and now you're like, okay, if I leave here, what do I do with that? I still got to pay my debt. It's like having 2 or 3 mortgages, and so there's a lot of responsibility in that, and so it's a fearful jump, and you go, gosh, will people really appreciate what I do? Will they understand? And really, it's finding the right patients who, like you said, they want to get better, and they're going to invest. And that's the people who's paid to go get a massage. They're not covering that through insurance for the most part, or unless they have a health savings account or something like that. By the way, can people use to come do a health savings account and flexible spending?
yeah.
Right?
Yeah.
Absolutely. Yeah. FSAs, HSAs, all welcome. And I love them. I've used them before. I was injured for 2 years at one point, and I had like $4,000 on an HSA, and I got to use it and get myself better out of the medical system with the cash that was on there. So
Yeah.
I'm a firm believer and lover of HSAs, as well as we're getting approved for care credit right now too, as well, which is pretty awesome.
Yeah, I think it's really important to make it accessible, because people don't realize they can go to someone like you and get better. And I sent you a patient, you got him better, and like he signed up for 8 visits. In 5 or 6 visits, he's perfect again. He goes, can I save those in case I hurt myself again later, because I feel great? And that's the way it should be. You get better and you move on to the next patient that you can help.
Yeah, it was interesting. Jen just had a patient the other day. Do you want to share that story where she was like, how are you going to get me better that fast?
Oh yeah, I was evaluating a new patient with the total body diagnostic and just kind of looking at everything she had going on. And she's had this roller coaster of neck issues for a few years now, and it just flares up so bad and totally floors her. And she's tried physical therapy, and she's done the traditional, you see the physical therapist for 15 minutes, she's in there, and she was, did 12 visits, had very minimal improvement. Within months of stopping physical therapy, it was all back to like the full pain. And I evaluate her, do a couple treatment techniques, and she was like, wow, that's so much better. And I was like, cool, I think we just need 5 visits. She's like, how can you get me better in 5 visits? And I was like, okay, let's look at this. You were seeing a physical therapist for 15 minutes. So you had to drive to the physical therapist. You got them for 15 minutes. So 4 visits is about what you're getting in 1 visit of me. So you're only having to drive here once. You're getting attention from me for that entire hour, one-on-one. So basically every 1 visit of mine is 4 visits of theirs. So we have even more than 12 visits, and you're getting the one-on-one therapy with the true care. And she was blown away. She's like, thank you so much. And she just was so floored and grateful that I was only prescribing 5 visits, that she was like, here, I'll pay for the whole thing. Let's go. When they can see the value in that, it's pretty powerful.
Yeah, when you're in chronic pain and you're hurting all the time, you can't function, and you have to look and say, okay, how much do I get paid at my job that I can't do because my shoulder or my neck's hurting me forever. So a lot of people who are professionals think in those terms. They say, okay, look, what do I have to do? Like, I'll work out a lot more now to get better rather than stretching it out over 2 years. Right? You don't have 2 years. You got a business to run, and
Yeah.
so it is amazing how when people really appreciate that, and when you help from one of my things is I was here in San Diego. I didn't really have a chiropractor, physical therapist that I was using, and I tweaked my back, and I limped around for like 6 weeks probably, and I'm like, oh, it'll get better, and it didn't. And my buddy's like, what the heck are you doing? I'm sending you my car. You're gonna go today. You're gonna go, and I got adjusted. And I was like 95% better in like that. I was like, why did I wait so long? And even my chiropractor now, she saves my life all day. If I kink my neck or something weird, I'll go, hey, can I get in this week? And then I'm adjusted. I get back to normal. It's like totally worth it. It's like ridiculous. It's crazy. Why suffer when you don't have to?
I think we just watch so many people suffer, and we're so used to suffering, and suffering so normalized that we just do it, and it kind of shifts and changes. But you had asked a question a little bit ago about where we really found our patients when we started. And I think being, who we are, and the passion we have for what's been going on in the last couple of years, I think it's important for us to chat about that and share some of the amazing people that came into our lives, because standing up for what we believed in and for our morals and our values is what truly brought the majority of our patients to us in the beginning. Do you want to kind of share some of the angels that came into our lives?
Absolutely. I would love to. Okay. So basically, we were given like some instructions on kind of where to find patients, and that was through like doing community outreach events and then workshops later on. But the first community events and they're like, what you're passionate about, like what do you want to give back to, where do you want to create impact? And it was the freedom loving community. So we were going to like Peggy Hall events so that we could learn about our rights and in defense against all the kind of big Kaiser, big pharma, whatever that's coming down on us. And so we started opening up like vendor tables, vendor booths, even outside of the board of supervisors, and building the email list, giving out free total body diagnostics, raffling those off. But also too, my first patient was this woman named Christina Werner of Public Square. So Public Square and Christina, she's been one of my angels. And she had been in, I think, chronic pain for about 4.5, maybe more years. She had some sort of, I think she had some sort of surgical procedure for her shoulder or her neck. I forget, it's been a long time, but she got a nerve block, and she told the doctor she didn't want a nerve block. She was like, do not give me the nerve block. And then while she was under, they gave her the nerve block anyways. And so I think there was some scar tissue, some connective tissue buildup right up there around her facets of her cervical spine, which she was getting this nerve pain constantly. So my first visit with her, I was able to eliminate that nerve pain with these specific movement patterns that she had for like 4.5, 5 years. And she was like, oh my gosh, I've been to physical therapist after physical therapist, chiropractor who's never been able to do that. And so within a few visits with me, she was able to play volleyball, which she hadn't played volleyball in like 5 years. So that was the first one. She set up all the stuff. She got me like on TV doing interviews, and then she was sending patients my way to, bought some gift certificates to put in some baskets, some other freedom events. And then the next angel is Amy Reichart of Reopen San Diego. She opened up the nonprofit. We went to one of their first meetings in the beginning when I was still employed by Kaiser, just trying to learn what we could do. And we didn't know the impact that Amy was going to have in our lives. And she's also running for board of supervisors right now, but she was like sending us, she was like, come to this event, come to that event. And she got us up speaking up on stage at like one of the Peggy Hall events too, as well. She got me on the news, but the news decided not to showcase me that day, because I think I was talking about a lot of inspiration, motivation for people that could have been in our shoes. So they decided not to put that on, but she got me on TV. She sent multiple people our ways. She put us in the newsletter, which got patients coming to us. And so those two were dramatically influential and helpful. Our two angels, Amy Reichart and Christina Werner. And there's a bunch of other things, but
yeah, it's awesome when you take a stand. I mean, it's a hard thing. It's a hard thing to take a stand, and you know, I was surprised too initially when I was watching it, because I know a lot of good doctors and nurses, and said, these are my religious beliefs. And people said, no, those aren't your religious beliefs. You can't do this. We're going
I
to fire
know.
you. And it's like, wow. I mean, put these people under major stress. I mean, the amount of stress we saw, I mean, and still see, I mean, it's still going
Yeah.
on. And you think, wow, how can I determine whether you have firmly held religious beliefs or not? Right. And it was really, it's really shocking actually of how our rights got trampled. And the reality is it's going to take 3 to 5 years probably for people to win in court, but it's gonna take that long. And a lot of us don't have 3 to 5 years of not being employed that we can deal with, you know, and survive.
Yeah, it's kind
Yeah.
of scary truth that's we had to make that decision of, do we chase that, potential of proving our point to Kaiser and saying you were wrong. A lawyer, the only person that can say our religious beliefs are true or not is God, right? But we had a lawyer tell him that his religious beliefs were invalid. I mean, that's not, how is that even a possible thing? But we had to kind of decide if we were going to chase that beast or if we were going to serve. And we've just decided to really serve. We've decided to show up for our community and have a space that people feel safe in, and they can come and they can get better and they can heal emotionally and physically. A lot of the times that's what we hear from our patients is they can take a breath of fresh air, literally, because they don't have a mask on. And they can feel like they can get better and they have hope again. It's something we hear a lot of. And we just decided that was our priority. Our priority is to serve. Our priority is to be there for our community and for others that have the same beliefs and values. And that's where we want to pour our energy into, because it's just exhausting to feel like you are constantly in a fight.
Yeah. And I'll add to it a little bit. We literally spent $10,000 on legal counsel during this whole almost like chess game, it felt like, with Kaiser.
Yeah.
10,000. And people were like, what are you going to do? You're going to sue Kaiser? And at first I was like, yeah, I totally am. And after a while, I noticed that I was starting to like get camera shy, because I had seen people with motor vehicle accidents, disability, whatever, and they get followed around by like personal investigators and stuff like that, and they can't post certain things on social media. And literally, I felt like there was going to be this ceiling, this cap holding me down and keeping me there if I decided to proceed forward with that lawsuit. So I was just like, nah, I'm not going to do that. I want to be loud. I want to inspire. And I want to show other people that are in our shoes, whether it's healthcare workers, whether it's fire, whether it's police, whether it's teachers, that we are doing great. We're doing phenomenal. We're not just keeping the lights on in our clinic, we're flourishing. And I want other people to know how well we're flourishing. So instead of having to, I mean, we're dealing with enough censorship these days, I feel, have to censor myself to prove a point. No, I was like, let's just keep going.
Yeah, you can imagine how as doctors feel now that this AB 2098 passed and it says, okay, if you say the wrong thing, we're going to take your license. I mean, it used to be, I've been practicing for 20 years. You'd only hear doctors losing their license for doing crazy stuff like sleeping with a patient or, sniffing cocaine off their desk. I mean, that's who lost their license or doing crazy. But speaking, using your First Amendment rights to say, here's what I think, here's what I'm seeing in my clinic, that's true. It's incredible. It really is an incredible time. I've never seen anything like this, where the problem is we used to have grand rounds where you say, hey, you handle it this, like someone injures their knee. Here's the physical therapy I do. Here's what you do. We're doing a different approach. Is it working for both of us? Is one better than the other? But now it's like, no, this is approach. No one can deviate.
Yeah.
Right. And so the good doctors and the good people are going to say, I'm out. I'm not dealing with it anymore. And so it's hard, because then you're going to be stuck in that, like you said, the pizza oven. Everyone just goes through and does the same thing all day, and you're not getting results. And that's the standard of care. And it's crazy because we could do so much better. Like you said, Jen, someone comes in, you spend an hour with them. You say, oh, how's the marriage? How's things at home? You have time to talk about these things. And you realize, oh, you're up till 3 a.m. every night, and you're getting up at 6 to go back to work. You're going to the club every night. Maybe we work on that, and when you have 6 minutes to accomplish all this stuff, you don't have time to even think about those things, or you don't even want to go there, because a lot of the docs I know are like, I don't even ask anymore because I've got 6 minutes now. I don't have time to, talk about your kids, smoking crack every day or whatever it is,
Yeah. You have no time to actually, you only have time to treat a chart. When you have that 6 minutes, you don't have time to help a person. Right. And that's really what it comes down to, is we got into medical to help people, not to read a chart and decide the bare minimum of what we could potentially do to make someone better in the fastest time possible. That's just not medicine. And I think that's what scares me most about what we've seen, is the mass exodus of and we're now, with this passed in California, we're going to see even more of it, is like the doctors that think for themselves, the ones I want to work with, are leaving the field. Hopefully many of them do what you do and go out into this concierge style, which is what we really, I mean, even for the birth of our child, we're, hiring specific person on our terms in our home to birth our child, God willing. And it's scary that if you go to the hospital for an emergency, you kind of have this understanding that the majority of the doctors there will just follow the check boxes they're told to, because that's how they're still there.
Well, and not only that, what I've learned, and I'm looking at it too, is, like big corporations, their HR departments, a lot of times they'll say, oh, we do a wellness thing, and they click the boxes, but it doesn't really help anyone. They're just doing, they're just going through the motions. They go, we don't really care. We'll do a Biggest Loser competition. And then, we check the box, like, but that doesn't work. Yeah, we know, but at least we did something. We have to check the box that did you talk to them about this? Did you? And it's like, no one really has the vested interest of either their employee or their patient,
and then how
mind.
can those employees have the best interests of their patients, because nobody has their best interest? It's all kind of survival, and it puts everybody in this really bad place. I don't know. It's a scary, sad thing to see happening so blatantly in the medical field.
Yeah, and the other thing I've noticed too, I mean, if you go, okay, and I'll freely admit this, right, is, okay, someone injures their back, the worst possible person is the doc, right? Because we're gonna say, oh, because here's some anti-inflammatory, we'll give you some prednisone, and then they have a structural problem that's going on. So then the problem becomes, after that, it's like, and maybe you can help me with this. Like, I've had really good response with physical therapy. I've had really good response with chiropractic, but it's funny that, like, everyone is territorial, it seems. So I think the perfect team is like, say, hey, let's have a chiropractor, let's if it's appropriate, get you back in track, and then have physical therapy keep you in shape, so you're not popping out of place all the time. What do you think about that? It seems like there's always an antagonistic, not always, but my good practitioners say, hey, there's a place for everyone. Some people are going to benefit from one modality over the other, or sometimes use both, or hey, physical therapy is the best thing for this one. What do you find professionally in that?
To start answering that question, I want to clarify something for people. Is oftentimes we've been taught to believe that the only way we can see a physical therapist is because a doctor prescribes it, and you can go to a chiropractor whenever you want, right? But actually we have direct access. So we can see a patient without a doctor's referral, which is really amazing. So you don't have to, go through the doctor if you don't want to, unless you have a trusted doctor like you, really is, like, okay, what do you think I should do? But we do have some chiropractors that we partner very close with. And I'm going to let Owen kind of expand on that, because we actually really, truly believe what you just said is we can work in tandem in so much more strength than we can work individually, if we just have to kind of let our egos go.
Yeah. So here's my philosophy about it. And that is, I feel like it's a fixed scarcity mindset that creates that territorial, as if someone's going to steal your piece of pie sort of thing, as well as like a repeat customer sort of a system. That is kind of what seems like the healthcare system is. So basically, I listened to a podcast years and years ago by Lane Norton. He's he's a natural bodybuilder, as well as I think he's got a PhD in exercise science, sports nutrition, stuff like that. And he used a quote, probably from somewhere else, and he said, "A rising tide floats all ships." And so he said, we're never going to run out of sick, hurt people, particularly with the model that we have currently going on. He's like, if I had all the sick, hurt people, I couldn't take care of them all. We need other people to help take care of people. So rather than this, oh, physical therapy is better than chiropractors, which is better than acupuncture, which is better than functional nutrition. No, 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 no. And then let's talk about mental health too. That's one of the main causes, I feel like, with a lot of things going on, is mental health issues. But so for us, we want to get on all the same team. So we reach out to multiple chiropractors, acupuncturists, and we partner with them. We become referral partners and success partners, like with this guy that came into our lives, another God thing, I feel like, named Dr. Vivek Soham, who's a NUCA doc, which is this specific type of chiropractor that only adjusts C1. And his goal is to not continue to see you once a week. It's to not have to see you again, similar to like a physical therapist philosophy. Interestingly enough, correcting that C1 can correct some tonal issues that a lot of people have, these patterns of these structural tone, the going all the way down their muscles. Well, if they've been in that position for so long, he can correct the C1, and then they can kind of shift back and get back into balance. But then all the connective tissues that have adaptively shortened to be in that position just kind of bring it back into place. So he and we've started sending people back and forth to each other to create the optimum patient care plan, where he works on C1, then I come in and I work on all the connective tissues through myofascial decompression, some people call it cupping, as well as instrument-assisted soft tissue mobilization, joint mobilizations to loosen up the capsules, get their range of motion back to normal. And so it's pretty cool, actually, to take this holistic approach. We got Jen with the essential oils over here, doTERRA.
Yeah, I want to touch on that too. Yeah, I want to talk about that too. Yeah, and when you have more tools, that's the thing is, for me, like you talk, I don't, gosh, I'm excited talking to you both. But you know, the one thing that excites me is when you say, look, God opens doors, God closes doors. And sometimes during the journey, you're like, this sucks. And then you start realizing, oh, a year later, oh my gosh, that's the best thing that ever happened, you know? And so with that, and then saying, hey, look, I have a lot of modalities. People will say, well, you believe in faith stuff, that's hocus pocus. Like, hey, you know what? Some of my best tools, best medicine, best tools, when someone said, Doc, can you pray with me? I'm going through a hard time, right? And I have that tool. I go, okay, I have that in my quiver. Oh, you know, I need the best physical therapist. I got that. Who do you want to see? You know, like my job is to be the coach too, and say, okay, let's find the best team that we can to get you healthy. Like, it doesn't have to be me, and seeing that. And then, you know, having the tool of essential oils, which a lot of us don't really understand. I mean, I would love to hear a little bit more about that, of how you do that for, you know, tension, stress, you know, all the things that I think one of our biggest killers is stress, you know, and loneliness and sadness and, you know, all these other mental things that affect our physical, for sure.
I totally agree. I will give you a quick backstory of why I use essential oils that will create clarity for you on this. Is I was in a very serious accident in 2009. I was hit by a car and I was riding my bike. I have a spinal cord injury, a brain injury, a brainstem injury, and all kinds of the normal back injuries, herniated discs, all of that. And I was in severe chronic pain for 5.5 years. I mean, I was in my 20s and I literally had to decide, could I do laundry today or make dinner? Because I couldn't do both. My life was completely altered. And I tried all the things, and things helped a little bit here and there, yoga, acupuncture. But there got to be this point, and I did all Western medicine for 8 months. I took every pill they told me to. I was on 30 pills a day. I was completely disabled, and I was a walking, miserable zombie. And when I was told by the head of neurosurgery from Scripps that I'd be on those medications for the rest of my life, I went home, I put them in a shoebox, and I said, forget all of you, I will do this on my own. And I never took another medication. And I just grin and bared the pain. So I was told by my acupuncturist, who I survived by 2 to 3 days a week just to get by. And she said, I'm not going to see you again until you sit down with this girl and talk about essential oils, because I wouldn't do it. I was like, that's waste of my time. I'm not doing it. So I finally sat down with this girl and she's like, all of these oils are going to change your life. Yada, yada. I was like, crazy. Okay. And I was like, listen, I'll do everything you say for 1 month. And at the end of the month, when they don't work, I'll come back. I'll tell you they don't work. We can all move on and everyone will be happy. And she's like, okay. So I invested in doTERRA's oils and I started using a few different oils and supplements for about 6 weeks. And within 6 weeks, I had my first pain-free day. And it was the most amazing day of my life.
And how long?
It was 5.5 years. So I was blown away. And then I
oh
went back and I
man.
kind of need to know more about this. And she was like, you should sell doTERRA. And I was like, I will never sell doTERRA. And then 6 months later, I was selling doTERRA. And that's actually how I paid my bills after I left physical therapy. But to answer, just so there's some background, because there's a lot of skeptics out there of like hocus pocus essential oils. I'm one of you. But what we do in our clinic with the essential oils that I think is very powerful is when someone is high level of stress, cortisol's racing, breath is shortened, I can't get any relief in their joints and their muscles by when they're all locked up, right? So we'll often start with some lavender essential oil in their hands or adaptive essential oil, and we'll have them breathe, because the number one stress reducer, according to the American Institute of Stress, is to breathe. Then you add an essential oil. Oh my goodness, you're triggering the limbic system, you're changing that emotional state in the brain. So we just often add that. We always have calming essential oils in the clinic diffusing, just to give that homey, help, like peaceful aroma for people. And so we'll use those tools in the clinic with our patients. We'll also use them with ultrasound and other tools to just help enhance our treatments. And then we have our patients come to us and they're like, I need these at home. I want this support. And that's where we take it to the next level, and we sit down and we do a wellness consult with them, and we decide what they need to help support hormones or stress or anxiety or sleep or aches and pains. And it's just a beautiful blend of the two. And I feel so blessed that I get to pursue all of my passions under one roof and truly help people.
Yeah, that is so awesome. That's all. And I got to visit your clinic yesterday. So coming, and I don't even want to say clinic office, because it's like my office. You come in and it's peaceful and it's calm, and you got a little waterfall going, whatever. And it's not this clinical, like, go sit down, you're number 8 on the list, we'll call you when your time. You know what I mean? My office, it's like, it's so intimate that it's like you're the only person here, so you're not going to get lost in. At my old office, it was so busy that this waiting room, I'd be like, where's my patient? They're 20 minutes late. And they will, oh, they've been here for half an hour. They're sitting there. We didn't see them, that kind of stuff. That's not going to happen here. And at your office, it's the same thing where, you walk in and it's peace and you got everything set up, ready to go. And, it's not like this mill, like I think enough people now don't want to be part of that mill system where you're not helping me and I'm just another number. It's crazy, right?
Totally.
Oh yeah. But so speaking on essential oils a little bit, kind of the scientific aspect of myself, 'cause I'm a big kind of science geek, and one of my favorite subjects was chemistry. If I wasn't so passionate about physical therapy, I would have become a chemist for sure. So the essential oils aren't just snake oils, and particularly doTERRA, who does tons of research, has third-party testing, did a study of their lavender essential oil, a 10-year study, and it was all of them were 99.9% linalool content. That's what they were judging it with. And so essentially there was standard deviation 0.1% difference, whether it was 100% or 99.9% as far as the linalool content. And something interesting about linalool is they've done studies on linalool, and they compared it to benzodiazepines, and linalool and benzodiazepines did the same thing as far as stress reduction, modulation for anxiety and stuff like that. So, and this is something natural rather than taking a synthetic version of it that technically you become physically depending on and addicted to over time. So that's one of them. Another one is like limonene in the citrus oils. Limonene has been shown to help support the liver as well. And then we use copaiba and frankincense. And one of a PT whose wife sells doTERRA as well. He used to own Gas Bar in San Diego, physical therapy, and he taught me how to use ultrasound, to use pulsed ultrasound with copaiba and frankincense to push it further and deeper into the tissues as a natural anti-inflammatory, because copaiba acts with the cannabinoid receptors, the CB2 receptors, has direct access to them, and it can create anti-inflammatory. So it's like there's so many ways we can integrate this to physical therapy as well as just overall wellness too, as well, scientifically proven with research.
Yeah, I was reading up because we would have patients after COVID having their sense of smell gone. And I was reading up on, I go, what works? And, one of the things was lavender syrup. I don't even know what that is, but there was actually studies done that showed it helped people to recover that lost their sense of smell. And so, it's just interesting how much stuff we just, we kind of, I could tell you how much stuff that I've blown off for 20 years, and all of a sudden I was like, oh, there's something to this, like the gut microbiome, which we talked about a little bit yesterday when we were together. It's like people don't realize, like, we blow it up and go, that's crazy. How can that be? And then you look at when I looked at the research, I was really blown away about how much of an impact it can have on our immune system and, pain. These lipopolysaccharides, if you have leaky gut and they leak in and they cause all kinds of emotional stuff. And I've seen it in my practice, and it's amazing when you see someone improve from that.
Yeah,
you know
it really is.
And people don't realize also, I'll tell you from my standpoint, I have patients who I can't control their sugars, but they have severe neuropathy, nerve pain, or their back's hurting them really bad. We get that back pain better, and all of a sudden their sugars start normalizing. It's not that they have a shortage of drugs. It's just that they're in pain or they're stressed or they're not. My type 1 diabetics, when they get stressed out, anyone listening knows this is true. Their sugars go crazy. And we have data on that, of why that's happening. So it's really just trying to attack from every angle we can for wellness.
Mm-hmm. And it's a beautiful thing when we can have that open mind of, oh, you have a tool that I haven't thought of before. Let's chat about how we can collaborate that. One of the things you see when you walk into our office is all of the business cards, and it's Z health practitioners, acupuncturists, physical therapists, massage therapists, chiropractors, your cards. And we have so many different neurofeedback. Like we never have a one size fits all for anyone, because we know that we are not, the number one person that can heal everybody. We get to create that tribe that we used to all have of healing and community. And we get to cultivate that for our patients again. And it's so nice to be able to have all these tools.
Yeah. And it's fun to see, stuff you don't understand working, as a matter of fact, well, one of my employees, I won't say who, but she was having severe back pain, neck pain, and all this stuff. And she ends up going to chiropractor, wasn't helping. She tried this, tried that. And the chiropractor goes, you should try this acupuncture and just see. And then she said, this is the dumbest. She was laying there thinking this is the dumbest thing. And then all of a sudden she had this electrical shock go through her body. She goes, I think something's wrong. She told the person, she goes, no, you're resetting. And then pain gone. Pain gone. And you go, this is great. I'll take it. Like, even if, like, people go, how do you know it's not a placebo effect? Like, I'll take it. If I'm not in pain and I can go and do my job and go for a workout now, and like you were talking about people that, now can play tennis, and the emotional benefits of exercise. When you're hurting and you can't exercise, it screws up everything.
Yep.
And so you realize how important having that balance is, of, getting some sleep, and, and we'll have to get the doc's name with the C1, because probably migraines and all this stuff people are taking tons of drugs for, and you go, oh, adjust C1 and it gets better.
Migraines, tinnitus, my brain injury, like ongoing concussion symptoms, performance caps. It's unbelievable what we are both personally going through his treatment regimen to experience it. And also because, we've not been the most gentle on our bodies. So he's helping us with a lot of things just so we can better speak to it and share. It's pretty amazing. There are some incredible practitioners out there. If you kind of sit and ask and are open to what comes your way, like we've talked about with God opening doors, is if you just sit and ask, the right people are going to come into your path, and you just have to trust.
That's right. And then take the step, like the door opens to take that. As a matter of fact, it's funny, I've talked about it on the podcast, but when I resigned, it was pretty much, and I'm not a spontaneous person, but it was pretty much a spontaneous. I saw the right. It's one of those things, and then, I came back from a conference and I was just slammed. Like, I knew I was going to get a break for 6 months. It was ridiculous. I go, look, I need a full-time a nurse practitioner or PA to help me out. I just cannot deal with all the people. It's too much. And so anyways, I resigned, and I walked back to my office, and I'm thinking, oh, I just really resigned. I better call my wife and touch base with her. But I remember it was like the vision I had just standing there in my office was like, okay, close your eyes. You're on the edge of the Grand Canyon, right? And are you going to take that step? God's like, hey, take the step and I'll put dirt under your feet. And so I take the first step, second step, third step, and you just stay on track, stay on that line, and listen and know, and everything works out, even though it's scary, because if you take one step to the left or right, you're falling in the cliff. But it's getting on that right path and saying, okay, here's what I want to do. Here's what my passion is. Here's what I like. I couldn't work the rest of my career just being that kind of, conveyor belt doctor. It just wasn't going to happen. And I never was. And that's why it was such a thing, is I never fit the mold of,
Mhm.
I was trying to be more efficient. How do I be more efficient? How do I see more patients? Because if I didn't see more patients and I saw fewer patients per day, it would take a lot longer to get in to see me because it was a huge wait. So I was like, okay, so what do I do? Do I rush through everyone and see everyone fast? Or do I take my time and it takes longer to see me and then you can't get in when you want to? So that was my dilemma, because I was never going to short circuit my or shortchange my patient. So I would work through lunch every day, for instance. And then, as Owen, as you said, is like you spend 2 hours a day doing paperwork or kissing the insurance company's butt, just try to get paid. Now it's I'm documenting for my protection, my patient's protection, right?
Yeah.
So it's not to overcode or put all these things in there so that you get paid for what you do. It's ridiculous how much, what we do is not valued unless we put it all on paper and write it down and check this box, and, oh, you didn't check that box, so you're not getting paid. I mean, all these loopholes and craziness, it's unbelievable.
It is. It is. Medicine became paperwork instead of patient care. And now it's amazing to see what you do for your patients, because you get to spend that one-on-one time with them. I love hearing the stories from people in my life that work with you, and just from you, with just the impact you can make. And I know we get to do the same thing, and that's so powerful.
Yeah. And a lot of people, it was like, seriously, like this one patient came in, I was with him for 5 minutes. He goes, "You're my doctor and I love you." And I go, "Why?" He goes, "My last doctor, I never saw him from the front. His back was turned to me, typing the whole time I was talking. Like, he didn't examine me or anything. He didn't put a stethoscope on my chest. He just said, 'What do you got?' 'Okay, okay, yeah, okay, yeah, oh yeah. Here, I'll refill your medicine. Here you go. We'll see you next time.'"
They don't even
It's
have
like,
to.
it's insane that people put up with that.
They don't know any better.
Yeah, you don't know any better. You think that's the system, that's the way it is, and you go realize, no, it's not the way it
Yeah.
should be. You have to connect, and like you said, facial expression is a huge thing, and just being able to connect with a patient, and they have to trust you when they're putting their health in your hands to help that shoulder pain or neck pain or back pain that's debilitating. Because again, everyone knows when you're in pain, you're miserable to be around, and so you have more social conflict and problems. The more social conflicts and problems you have, the worse the back pain gets. And then you get into that spiral. You can't sleep, and then you're stressed. A lot of people listening are shaking their head. Yes, 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 that's true. I've been through that, or I'm going through it now.
Yep, absolutely.
So
Totally.
now, Owen, you have something else to add, man? Sorry, we got excited talking.
Oh, no, it's all good. But kind of to bring it back a little bit, how you were talking about, like, you were standing on the edge of the Grand Canyon, with your eyes closed and stuff, and you just took one step at a time. So I didn't quite get to that point. I felt like something different happened to me, as if I got like kicked off the edge of a cliff or pushed off the edge of the cliff. But so about like 3 months before all these crazy mandates started going out and all that stuff, when I was doing my deep inner work, a lot of prayer, a lot of meditation, I was being guided. I was basically being told by God that I was not on the path that I was supposed to be on. I was not working in the field, the career that I was supposed to be working in. And I was not hanging out with the right people and forming the right relationships. And this, kept coming into my head when I'm, participating in the deep inner work. And I kept just telling myself, like, no, that's not God. That's an intrusive thought. I don't know why this keeps coming across my brain, but I work for Kaiser. I get paid the best as a PT. I have the best con ed budget. I have the best PTO allotted to me that I can actually use. I have the best retirement plan. I'm good. I have the best of everything as a physical therapist. And then my friends are fine. My friends decrease anxiety in my life. And through research, that is shown to create happiness if you have a reduction in anxiety, apparently. So I was like, I justified all these things like, nope, I'm good, even though I wasn't necessarily good. Like even working for Kaiser, I was working in home health, and that's what I wasn't passionate about, but it gave me the psychological relief that I needed to be a cog in the wheel. So after about 3 months of ignoring what God was calling me to do, I felt basically like Jonah, essentially, like we're trying to run away from God. And then basically Kaiser was the big fish, swallow me up, kick me out of the nest, take the golden handcuffs off, whatever. And it's just like, I just kind of just like looked up and I was like, okay, yep, I see you. That was you. Now I'm going to go preach to Nineveh. So, you can let me out of this fish now. And
Yeah.
then that's what got me on the path.
Yeah, it's
Kind of
scary to
similar.
jump out of that security. Even it's like being in a bad relationship. It's still a relationship, and so people are afraid to leave that bad relationship or that bad job. But a lot of what I treat is I talk to people like, "How's work?" And they're like, "Oh my gosh, my boss is a jerk, and he fights with me all day, and I got to deal with it and the stress. Like every Sunday night, I get a headache, and I'm tense." I'm like, "Yeah, I can relate. I know exactly what you're talking about. That's how I used to be." But I think now stepping out, and the big thing is healers have to be healed themselves, right? And we forget that a lot of the people, like, you want your doctor to really focus on you, and they're stressed out, they got marital stuff because they're never home, and they got, it's hard to be a healer when you're going through. I remember at times talking to patients, and I'm like, you have it way better off than me. Like, I would tell people, like, as a matter of fact, that's what happened to me. A good friend of mine who I just saw last night, as a matter of fact, he basically said, like, we were best men in each other's wedding. We played football together in high school, and you have all these connections. Like, we went through a lot together. And he said, Brian, when's the last time we got together? When's the last time I talked to you? Has it been a year? And we haven't had dinner together in 3 years. I was like, wow. He lives in Orange County, and he's a pastor, so he's busy, and I'm busy on the weekends, and so he's busy during the week, or I'm busy during the week, type thing. So I was like, wow. Yeah. And he goes, and I go, hey man, it's not you. It's just, I'm so busy. Here's my life. And I told him how crazy my life was. And he goes, Brian, if you were your own patient, what would you tell yourself? As a matter of fact, I had him on the podcast. He was in a computer firm making a ton of money in Orange County, ridiculous amount of money. And he goes, yeah, he calls me one day. He goes, hey, Brian, I'm leaving my job. I go, you love your job? He goes, yeah, I know, but I'm called to the ministry. I go, okay, what happened, man? Did you have an affair? What's going on? Do you have a midlife crisis? He goes, no, I'm called to do this. And he's so happy now, and life is so great. But he took like a 90% pay cut. I go, are you crazy, dude? Like, you're nuts. He goes, Brian, it's not about the money at some point, and so you start realizing what matters and what your passion is. And I had to realize that too. It's not about the money. And I think these things come across life to give us courage to take that step, and so many people listening now, they have a passion, and they just are so burned out, they don't have time to even look at their passion, or why they went into medicine, or why they went into physical therapy, and they're just a cog in the wheel, and this will speak to them.
Yeah. Yep. Very well said. We can get so caught up in the minutia of life that we forget to even look at what is going on in the present moment and how we truly feel.
Yeah, and I think, like, what you're talking about, vision and saying, okay, what if I could do anything? If I had a passion, what would I do? Right? What would you be doing? What would you like? What would be a perfect world for you? What would you wake up to, and what would you smell, and what would you, how would you live? And then you go, okay, then why aren't you doing that? Step towards that, at least, or at least try to open the doors, and look and see how that is. And I think we get motivated by, we want pleasure, or we're trying to escape pain, and a lot of times, like, the pain isn't bad enough for you to say, it's bad enough to go. And sometimes, like in your case, the pain wasn't bad enough for you to go, but then the door slams shut and says, okay, you got to do this or you're out. We don't care how long you've worked here and what your goals are, you're done. And you realize, you guys don't really care about me, do you? Right? You're just a cog in the wheel at that point. So we'll get rid of you and bring someone else in and fill that spot.
Yep. That's all they do.
Yeah. And it was interesting how you were talking about security. And a lot of people, they weren't talking about me, but I've heard a lot of people talk about that didn't really know they were talking about me at the same time, but talking about, like, healthcare practitioners, fire and police and all that stuff, like leaving their jobs, being terminated, or quitting. And they're like, wow, what idiots, just leaving all the security that they had, everything that they had, because they're not going to, go through with what they want, what they're mandated to do. And it's like, what are you talking about, security? There is no such thing as security when you're working for someone. One of my patients said the other day, he said, this is the security. This is the product. You are it. Like, there's nothing else.
Yeah, we forget that, and we lose our ability to function the way we should, because we're just handcuffed. Something, like you said, being handcuffed, saying, I know what can help this patient, but I can't talk about it, and then, even that, talking about your faith in a big system is very dangerous. They could fire you and go, wait a minute, trying to convert patients and stuff. But sometimes the patient, they open the door and they want to talk about those things. So in your own place, you have a freedom to talk about it if you want. If you don't want to, then, you don't have to, but that's another tool you have. And, so I'm just excited about what you're doing and helping patients. And I agree with you 100%. Building a team, say, hey, look, this person's not responding. What should we do? And I've seen lives change. A friend of mine actually was seeing a standard doctor and all that, and they couldn't figure out why she was having balance problems and all that. So my dad said, you should just go see a chiropractor. She saw the chiropractor twice, and the chiropractor said, you're not responding the way you should. You need an MRI of your brain. There's something going on. And boom, MRI, brain tumor. Like, she had been a year and no one picks up a brain tumor. Right. But someone
Wow.
who's good and understands, like, yeah, you're not responding. Like, what we did should have responded. And in 2 visits, they knew that, and when you realize, oh, this knee isn't bending the way it should, as a matter of fact, my daughter, her physical therapist said, you need an MRI of your knee. They said, no, it's just a strain or whatever. And she had a big chunk of bone in the middle of her joint that they had to go surgically remove. After ortho said, yeah, you're fine. There's nothing there. The x-ray looks fine, but they missed it. So, sometimes having good people who understand, say, yeah, you're not responding right. You need more work. And then hopefully we listen and go back to the drawing board and try to figure out what the underlying pathology is, because we
Yeah.
can miss it. So I have to
And be
ask.
humble enough to say, I might not be the solution right now. We need
Exactly.
other eyes. That's huge. I think that is one of the biggest things that makes anyone a good practitioner, is to be able to say, I might not be the fix for this.
Yeah, or I
Oh.
may not be the fix right now. We have to work on some stuff, like, that's what I'm up against, is food addiction and stress and lack of sleep and all that stuff. And so you start realizing, hey, we have to really address these big problems. Then we can get back down to what we need to do. Like, trying to quit smoking when you're going through a divorce is probably not the right timing, and you're set up for failure. You know what I mean? There's certain things you look and go, look here, but being able to verbalize that and say, yeah, it's now may not be the time. Let's work on these other things and stress management, and go and sit on the beach. And like you said, I was kind of smiling to myself, because so many people, like you said, the number one relief of stress is just breathing. And I tell people all the time, breathe, take a breath, relax for a minute. Don't weigh yourself 12 times a day. Like, let's look at this, right? And then some people, like you said, at least visioning, saying, okay, I'm all in and I'm going to do this thing. Because a lot of people, like, they weigh themselves one time, they didn't lose 20 pounds, and they go, okay, that's it, I'm done. Right? You give up too early, and especially going through physical therapy, sometimes you'll hurt worse at the beginning. So I've had people say, well, I tried physical therapy, I got worse on the first visit, so I stopped doing it. It's like, well, sometimes you have to go through that, and then we adjust what we're doing to fit what works for you.
Absolutely.
So I have to ask you
That's
too, in closing, because I don't want to keep you all day. I know you have patients to see. What's life's best medicine for you? Oh, and I'll ask you first, like, when you go, okay, here's what's life's best medicine, looking at like what matters, what's important, what motivates you to keep going and all that.
Man, life's best medicine, talking about like almost like a holistic approach sort of a thing. I would say self-development. So self-development books, motivational speakers, podcasts like this, anywhere that I can improve my life in mind, body, spirit, relationships, and finance. So taking a holistic approach on self-improvement, self-developing, and the spiritual aspect is definitely absolutely key. That's my life's best medicine.
I agree, man.
So I'd say on top of that, it's who you surround yourself with. We and only we have the power to control who has access to us and our energy, and who can impact us and our energy. And being someone who has a lot of toxic familial relationships, blood relationships, and was in a toxic marriage at one point in my life, I have learned the hardest way that only I am the one that can say who has access to me and for how long. And once you can make that decision and stand strong and realize that blood doesn't mean 100% unwavering access to you, you will never have your freedom. So I am so specific about who is allowed in my space, who is allowed in my home, who is allowed in my energy, who I absorb energy from, and who I give energy to. So we are the ones that control that, and we get to make that big decision. And it really, blood at the end of the day doesn't always have to be the tying force to those things. So control who you allow around you.
Yeah, that's so important. I think that's, what we take in, people have watched the news, they've been stressed out, the people will monopolize on your fear and your stress and your questioning. And so I think that's really valuable. Both of you, that's very valuable stuff. And so that's why I'm excited to be in town with you and to be able to share patience together and get people on the right track to healing, because pain, not being able to do your activity, all those things are affecting people. So hey, everyone, this is good stuff. There's a lot of good nuggets. You'll probably want to listen to this one back a couple of times. First of all, how do people contact you? I'll have all your contact information in the show notes. But if people want to track you down here in San Diego, how do they find you? Orange County, whatever, LA.
Yeah. We have people that drive 2+ hours to see us, so come on down. But the best thing to do is www.advancedptwellness.com. We have free ebooks on there for you about how to get yourself out of pain, tons of value. You can find our phone number, our address, our social media, everything right on that site. So head over to our website and come say hello, download ebook, say hi to us, send us a message.
All right, awesome. Thanks for the great work you're doing. And everyone listening, there's some great nuggets here. And, be kind to yourself, be kind to others. And sometimes just looking at those open doors, looking at these doors and saying, gosh, is my pain bad enough where I got to make a change? Am I suffering unnecessarily? And do I want to get healthier? Is it worth it for me to get outside the system a little bit? If you're in the system and you're struggling, say, maybe I need to step out and have some kind of a holistic approach, or someone who's going to send me the right person. And I love this approach, because that's mine too, is saying, hey, if I can't help you, let's find a food addiction specialist. Let's find someone who's a specialist in whatever area. If you're in pain all the time, let's look at that. Let's fix that, because that affects all of us, and the spiritual health is really important. So thinking about this, a lot of us don't think about it until we're on our back looking up thinking, oh, is this the end? Right. So, and I've had some great conversations with people about that recently, about like saying, is this the end? Am I dying? This multimillionaire guy is 48 years old on his back thinking, is this it? Right. So think about those things sometimes. And, again, be kind to yourself, be kind to others. Have a great week. And thank you for listening. Thank you for listening to this episode. We greatly appreciate your support. We would greatly appreciate a positive thumbs up on all of the platforms like iTunes and Spotify, or wherever you're listening. And we just thank you for our Patreon supporters. We greatly appreciate your help in getting this message out. We think there's a lot of important information, and hopefully this helps you. Have a great day, and thank you for listening, and thank you for your support.